Being told you have high blood pressure isn't the kind of news any of us want to hear. Sure, it might be better than what some people face, but we all know it can lead to serious consequences like stroke, heart failure, or kidney disease. And often that diagnosis is followed by a daily routine of pills that could last a lifetime, or at least a very long time. Most of the time, doctors tell their patients to take blood pressure medication in the morning. But could there be a better time, or even a better way, to take it? In this video, we're diving into the best time to take your blood pressure medication, whether it's in the morning or at night, and whether that timing actually makes a difference. Before we get into the details, there's something we often overlook, and that's compliance. Now, what do I mean by compliance? It simply means how regularly you take your medication and how often you forget. And believe it or not, that alone is one of the biggest factors in how well your medication actually works. All right, now that we've got that covered, let's take a look at what the study found. One major study suggested that taking your medication at night, rather than in the morning, might lead to better blood pressure control during sleep, and even reduce your risk of dying from cardiovascular disease by as much as 45%. That sounds pretty surprising, right? Here's what's going on. The idea comes from something called chronotherapy. This approach takes into account your body's natural circadian rhythms, those 24-hour cycles that influence everything from hormone levels to blood pressure. In people without high blood pressure tends to follow a predictable pattern. It rises in the morning after waking up and continues to increase gradually throughout the day. Then at night, during sleep, it typically drops by about 10 to 20%. However, blood pressure doesn't follow the same pattern in everyone with hypertension. In fact, experts have identified 4 distinct nighttime patterns. First, there's normal dipping, when blood pressure drops by about 10% to 20% during sleep. Then there's extreme dipping, where it drops by more than 20%. Some people hardly dip at all. That's known as non-dipping, with a drop of less than 10%. And finally, there's reverse dipping, where blood pressure actually rises during sleep instead of falling. The only way to know which pattern you follow is by wearing a 24 to 48-hour ambulatory blood pressure monitor, which measures your blood pressure continuously, even while you sleep. Studies have shown that people who experience non-dipping, reverse dipping, or even extreme dipping patterns during sleep have a higher risk of developing serious cardiovascular problems, including heart attacks, strokes, and heart failure, compared to those with a normal nighttime drop in blood pressure. And here's something important. People over the age of 55 are more likely to have a non-dipping pattern, meaning their blood pressure doesn't fall much, or at all, while they sleep. A major clinical study, known as the Hygia chronotherapy trial, followed over 19,000 adults in Spain with high blood pressure for an average of 6 years. Participants were split into 2 groups. Half took their blood pressure medication in the morning, and the other half took it at bedtime. Those who took their medication at night had better blood pressure control and were less likely to experience a heart attack, stroke, heart failure, or need surgery to open narrowed arteries. Here's what the study found. A 44% drop in heart attack risk, a 40% lower risk of needing coronary revascularization, that's surgery to open blocked arteries, a 42% reduction in the risk of developing heart failure, and a 49% lower risk of having a stroke. But before you think about switching your blood pressure meds from morning to night, make sure to talk to your doctor first. Some medications, like diuretics or water pills, are better taken in the morning because they make you pee more. And let's be honest, no one wants to be waking up all night just to run to the bathroom. Also, if you're someone who finds it easier to remember your meds in the morning, it's better to stick with that, because forgetting to take them altogether is actually more dangerous. Those ups and downs in your blood pressure can raise your risk more than just taking them at the wrong time. Just keep in mind, switching from morning to night doesn't work the same for everyone. That's why it's so important to check with your doctor first. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.